Getting sick today usually means canceling plans, swallowing something from a plastic bottle, and searching your symptoms online until a mild headache becomes a medieval curse. But for most of human history, there were no pharmacies, no antibiotics, no thermometers, and no cheerful receptionist asking for your insurance card. There was pain, fever, infection, maybe a suspicious leaf. So what did ancient humans actually do when someone got sick? The answer is stranger than they just died, because many of them clearly did not. Archaeologists have found people who survived shattered bones, amputations, severe disabilities, and illnesses that should have ended badly without long-term care. Somehow, prehistoric communities learned to treat wounds, recognize useful plants, support injured relatives, and decide which symptoms required rest, ritual, or a hole drilled into the skull. Medicine did not begin in a laboratory. It began with fear, observation, memory, and one deeply important human instinct: do not leave them behind. Before humans could invent medicine, evolution had to invent something much more basic: a body that knew how to panic correctly. Long before anyone crushed a herb, wrapped a wound, or blamed an illness on an offended ancestor, the human body already had its own emergency department. Pain told you to stop using the damaged ankle. Swelling helped isolate injured tissue. Blood clotting sealed leaks before your entire circulatory system became a regrettable puddle. Coughing expelled irritants. Vomiting removed suspicious food with the urgency of a restaurant reviewer who had seen enough. And then there was fever. Fever feels like the body has accidentally set the thermostat to desert funeral, but it is not simply a malfunction. Raising body temperature can slow the growth of some pathogens and strengthen parts of the immune response. It is costly, exhausting, and sometimes dangerous, but in evolutionary terms, it was often better than politely allowing an infection to multiply. These defenses existed millions of years before modern humans. Many animals avoid foods that previously made them sick. Some primates swallow rough leaves that may help remove intestinal parasites. Others chew bitter plants with biologically active compounds. This does not mean chimpanzees operate forest pharmacies or ask whether you prefer generic medication. But it shows that the boundary between instinct, learned behavior, and medicine is not as clean as we like to imagine. Our ancestors added something powerful to this biological foundation: social intelligence. Humans are unusually dependent on one another. A sick ape can sometimes retreat, recover, and rejoin the group. A sick human carrying a baby, gathering food, maintaining a fire, or avoiding predators creates a logistical problem for everyone nearby. Illness was never entirely private. It affected food supply, protection, childcare, travel, and the survival of knowledge. That made caregiving useful. Someone could bring water. Someone could chew food for an injured person. Someone could keep watch while they slept. Someone could clean a wound, remove thorns, or help a limping hunter move between camps. These acts may look like kindness, and often they were, but kindness also had excellent survival value. Helping an experienced hunter, skilled toolmaker, knowledgeable grandmother, or reliable food gatherer recover could benefit the entire group. Memory made this even more important. Humans could notice patterns. This bark reduced pain. That leaf caused vomiting. Rest helped after fever. Dirty wounds smelled bad. Certain mushrooms were food. Other mushrooms introduced you to the spirit world permanently. So the first prerequisite for medicine was not a plant, a tool, or a healer. It was a creature capable of feeling distress, recognizing distress in others, remembering what happened last time, and sharing that information. The body sounded the alarm. The group started taking notes. The first medicines were probably not invented by a prehistoric genius staring thoughtfully into a fire and saying, "I shall now establish pharmacology." They were found by accident. Early humans lived inside an enormous, unlabeled chemical laboratory. Every root, bark, seed, fungus, resin, and leaf contained compounds evolved to attract, repel, nourish, poison, numb, irritate, or kill something. Plants were not waiting politely to become medicine. Most were engaged in biological warfare. Our ancestors had to experiment anyway. Hunger encouraged people to test unfamiliar foods, and illness may have changed what they were willing to try. A person with stomach pain might chew a bitter stem, because nothing else had worked. Someone with an aching tooth might press aromatic resin against the gum and notice temporary relief. A crushed leaf placed on a cut might reduce bleeding, cool inflammation, or make the wound worse in a way that was both educational and extremely final. The successful experiments could be remembered. Humans are exceptional cultural learners. We do not merely discover useful behavior. We copy it, teach it, modify it, and attach dramatic stories to it so nobody forgets. Chew this bark when your joints hurt is useful information. The forest spirit gave this bark to your grandfather after he defeated the moon is the same information with better marketing. Animal behavior may also have provided clues. Chimpanzees and other primates sometimes consume bitter plants or swallow rough leaves during periods of parasite infection. Elephants, bears, and other animals have been observed selecting unusual substances when injured or ill, although interpreting such behavior requires caution. An ancient human watching an animal repeatedly seek one plant might have become curious. Or hungry. Probably both. Fire expanded the experiment. Heating could soften tough roots, release chemicals, destroy toxins, or concentrate substances in smoke and steam. Warm water mixed with plants created crude infusions long before anyone used the word infusion. Animal fat could carry plant compounds and be rubbed onto skin. Honey, where available, offered calories and could be placed on wounds, although no prehistoric patient would have understood antimicrobial chemistry. They would only know that sometimes the sticky stuff helped. Trial and error sounds simple until we remember what the error involved. There were no dosage charts, no warning labels, no distinction between medicine, food, poison, and hallucinogen except experience. A plant that eased pain in a small amount might cause vomiting in a larger one. Another might lower fever, damage the liver, induce visions, or do all three before lunch. The knowledge that survived was therefore not just botanical. It was social. Which part of the plant? Collected in what season? Prepared how? Given to whom? How much was too much? Medicine began when random encounters became remembered patterns. Then remembered patterns became advice. Unfortunately, prehistoric humans left no patient files. Nobody carved, day 3, fever improving, mammoth broth tolerated well. Instead, their medical history survives in teeth, bones, and injuries that healed when, statistically speaking, their owners should have been having a much worse century. One of the most astonishing cases comes from Liang Tabo Cave on the Indonesian island of Borneo. Archaeologists found the skeleton of a young person who lived at least 31,000 years ago and was missing the lower portion of the left leg. This was not the chaotic damage of an animal attack or an unfortunate encounter with falling rock. The bones indicate a deliberate amputation. Even more remarkable, the patient survived. The remodeled bone shows that the operation probably occurred during childhood and that the individual lived for several more years. Someone had controlled the bleeding, avoided fatal shock, and kept the wound from developing a lethal infection. Then the community supported a young amputee through recovery in steep tropical terrain. That is not rub a leaf on it medicine. That is surgery followed by long-term care. Teeth provide another strange medical archive. Hardened dental plaque, called calculus, can trap microscopic remains and genetic material for tens of thousands of years. In calculus from a Neanderthal at El Cedron Cave in Spain, researchers identified evidence associated with poplar and penicillium mold. The individual also suffered from a dental abscess and carried a gastrointestinal pathogen. Poplar contains salicylic compounds related to the chemistry behind aspirin, while some penicillium species famously produce antibiotic substances. This sounds almost suspiciously perfect, a sick Neanderthal taking prehistoric painkillers and antibiotics. But archaeology enjoys ruining a good headline. The evidence proves those materials entered the mouth. It does not prove why. The poplar may have been selected for pain relief, chewed as food, used as a tool, or consumed for another reason entirely. The mold could have arrived accidentally. There was no Neanderthal pharmacist stamping dosage instructions onto bark. Other skeletons reveal survival after major trauma. Shanidar I, a Neanderthal from present-day Iraq, lived with severe injuries, loss of the right forearm and hand, an abnormal gait, probable visual impairment, and substantial hearing loss. Reaching older adulthood with that combination strongly suggests social assistance, although bones cannot tell us exactly who helped or how. Then there are trepanated skulls, human crania with deliberately created openings. In many cases, new bone grew around the edges, proving that the patient survived the procedure. Why anyone performed it is less clear. It may have relieved pressure after injury, treated pain or seizures, served a ritual purpose, or combined medicine and spirituality so completely that separating them would have seemed ridiculous. The evidence cannot give us a prehistoric diagnosis, but it can show us the scar. And scars mean someone survived. The problem with prehistoric medicine is that the evidence rarely arrives with instructions. A plant compound in dental calculus may indicate treatment. It may also indicate breakfast. A hole in a skull may be surgery. It may be ritual. It may be damage that occurred after burial because archaeology occasionally hands scientists a mystery and then removes half the clues. Consider the Neanderthal from El Sidron, whose teeth contained traces associated with poplar and penicillium. The medicinal interpretation is tempting. The individual had a painful dental abscess, poplar contains salicylates, and certain penicillium molds produce antibiotic compounds. It looks like a prehistoric patient treating pain and infection, but looks like is doing serious work. Not every penicillium species produces a useful antibiotic. Even when a plant contains an active chemical, the dose may be too small to matter. And finding something in the mouth does not reveal intention. You could analyze a modern person's teeth, find coffee, mint, and microplastic, and conclude they were performing a complicated healing ritual before work. The same caution applies to medicinal plants found at ancient sites. Some may have reduced pain, inflammation, parasites, or digestive problems. But they may also have been eaten for calories, burned as fuel, used as bedding, carried accidentally, or selected because they smelled less terrible than everything else in camp. Trepanation creates an even larger argument. Prehistoric people in many regions deliberately scraped, cut, or drilled openings into human skulls. Some patients survived long enough for bone to heal around the opening. That confirms a real procedure performed on living people. It does not confirm the diagnosis. Perhaps trepanation relieved pressure after a head injury. Perhaps it was used for headaches, seizures, behavioral changes, or symptoms blamed on supernatural forces. Perhaps the opening allowed a harmful spirit to leave. Perhaps the operation was both physical and spiritual because ancient healers did not divide reality into neat categories labeled medicine and religion. That division is modern. A chant could calm a frightened patient. A ritual could organize community support. A healer's authority might encourage rest, fasting, or compliance with an herbal treatment. Even when the supernatural explanation was wrong, parts of the process could still produce real effects. Scientists therefore look for patterns. Was a plant repeatedly associated with sick individuals? Does the preparation suggest deliberate processing? Is a skull opening positioned near an injury? Are there tool marks and signs of healing? Do similar practices appear across many burials? Even then, certainty remains limited. Prehistoric medicine sits in the uncomfortable space between evidence and interpretation. Some treatments probably worked. Others probably did nothing. A few likely made the patient dramatically worse while the healer insisted this was part of the cleansing process. So the honest answer is not that ancient humans had medicine exactly as we understand it. They had experiments, traditions, beliefs, and results. Which occasionally is still how medicine feels. Once healing knowledge became reliable enough to remember, it became valuable enough to control. A person who knew which bark eased pain, which resin protected a wound, or which root caused violent vomiting had something the rest of the group needed. That knowledge could be taught through demonstration, guarded within families, or wrapped in stories, taboos, and ritual. The first medical specialist may not have looked like a doctor. They may have looked like an elder with an excellent memory and a deeply concerning collection of mushrooms. As human communities grew larger, healing became more organized. Illness was rarely treated as a purely biological event. A fever might be caused by spoiled food, an infected wound, an angry spirit, broken social rules, or all four at once. The healer therefore treated the body and the meaning of the illness. Plants could be applied while prayers were spoken. Wounds could be cleaned during ceremonies. Smoke, rhythm, fasting, touch, and storytelling could become part of the cure. Some of this was symbolic. Some of it was surprisingly practical. Ritual created structure during chaos. It gathered people around the patient, assigned responsibilities, and gave frightened families something to do besides stare nervously. Repeated ceremonies also helped communities preserve medical knowledge. A treatment hidden inside a memorable story is easier to transmit than a technical lecture, especially when writing does not exist and your classroom occasionally gets chased by predators. Care itself became a form of survival technology. The healed injuries found in ancient skeletons imply more than a single dramatic operation. A badly injured person needed food, water, warmth, protection, and time. Someone had to replace their lost labor. Someone had to help them move. A patient recovering from major surgery or trauma could not simply be told to take it easy while everyone migrated 20 miles. The group had to adapt. This may help explain how humans survived in environments where individual strength was not enough. A community that abandoned every injured member lost experienced hunters, skilled craftspeople, caregivers, and elders carrying decades of ecological knowledge. A community that supported recovery preserved expertise. Eventually, healing specialists gained social influence. Their remedies could become trade goods. Rare plants, minerals, shells, fats, and resins moved between groups not only as decoration or food, but possibly as substances with medical or ritual value. A trusted healer could become counselor, priest, pharmacist, psychologist, and occasional theatrical performer. The performance mattered. Confidence can calm a patient. Touch can reduce fear. Expectation can change the experience of pain. None of this means ritual magically cured infection, but it means prehistoric healthcare operated on more than one level: chemistry, psychology, community, and belief. Medicine was no longer just something a person tried. It became something a culture practiced. Today, getting sick can involve blood tests, medical imaging, sterile instruments, antibiotics, and a pharmacist calmly explaining that yes, you must finish the entire prescription. That world feels completely separate from a prehistoric camp where treatment might involve smoke, bark, honey, pressure on a wound, and an elder whose qualifications were mostly still alive. But the distance is smaller than it looks. Modern medicine still begins with the same ancient sequence. Someone notices that something is wrong. Symptoms are compared with memory. A treatment is chosen. The patient is watched. The result becomes knowledge. Science transformed that process by testing treatments systematically, measuring outcomes, identifying microbes, isolating active compounds, and removing as much guesswork as possible. Because humans remain humans, we still reach for remedies passed down through families. We still find comfort in ritual, whether that ritual is brewing tea, visiting a clinic, or reading the medication leaflet and immediately deciding every side effect is happening at once. We still want the healer to sound confident. We still want someone nearby when the body becomes frightening. The greatest prehistoric medical breakthrough may not have been a particular herb or surgical technique. It may have been the decision to care for people who could not temporarily care for themselves. A healed fracture represents biology. A healed fracture in someone who could not hunt, gather, or walk represents society. The amputee from ancient Borneo survived because skill met cooperation. Injured Neanderthals reached advanced ages because disability did not automatically erase their value. Long before hospitals, humans created mobile networks of food delivery, nursing, protection, and emotional support. Essentially, prehistoric healthcare came with terrible lighting but surprisingly strong community coverage. Our ancestors did not understand bacteria, viruses, immune cells, or pharmacology. They misunderstood causes, trusted useless cures, and probably consumed several plants that should have remained purely decorative. Yet they observed, they experimented, they remembered. Most importantly, they stayed beside the sick. That impulse still sits beneath every modern machine and medication. Medicine began before anyone knew what medicine was. It began when one human looked at another in pain and decided that their suffering was now a shared problem. And somewhere nearby, almost certainly, someone was holding a suspicious leaf.